Hey everyone, what's going on? Welcome to episode number 4 of the Student Speak series. In this episode, the 3 schools that are represented are from AT Still, Mount St. Mary's, and Baylor University. If you want to hear what they have to say, watch to the end of this video and get that value. Lego. Hey everyone, what's going on? My name is Justin, Doctor of Physical Therapy student and fitness coach. Here you'll find videos on fitness, physical therapy, and lifestyle that helps inspire self-change. This channel is all about lifting others and lifting weights. So let's lift for change, people. If any of that resonates with you, feel free to subscribe and hit those notifications. Now, you guys have been following the Student Speak series. We are on episode number 4 at this time, so most of you know what it's all about. But really quick, if you don't know, Student Speaks is a series that I created to represent all the different DPT programs. These students are volunteering their own time to represent their program, talk about all the pros and cons and all the different perks of their specific program. So you, as a pre-PT student, can gain value and insight from the student's perspective and not from the online university, the highlight reel perspective of their specific program. So this channel and this series is all about being real, authentic, and just giving you value on making the right choice so that you can have the best fit of your whole DPT program experience. Alright, so like I mentioned, 3 awesome programs. From AT Still, we have Tyler representing their program. From Mount St. Mary's, we got Jackie. And then from Baylor University, we got Jennifer. Okay, so let's just hear what they have to say. Get your popcorn ready, put this on the TV, and just listen and gain that value.
How's it going? My name's Tyler Slim, and I go to AT Still University. So really quick, I'm going to give you 6 pointers that can either be taken as pros or cons before coming to AT Still. So the first thing is that it's a traditional 3-year program. So this could be a pro, this could be a con for you, depending if you wanted like a hybrid program, if you're a very classroom textbooky type of student. But it's a 3-year program. You have 2 years of didactic work, which is pretty much all your classwork. And then you have 1 year of clinicals, and they send you on 3 10-week clinicals your final 3rd year. So that's the first point, very traditional program. The second point is that your first semester that you come to AT Still, you have a clinical the 3rd week that you arrive. And so to some, this could be intimidating. You're like, wait, I just got to school. I don't know anything yet. How could I be in a clinical? And this clinical is pretty much a way for you to get your feet wet in what the clinical environment is like, which I really liked. I think this is a unique part of AT Still that not a lot of schools have. So you're with a partner for the first semester for your clinical, and usually it just entails you're observing wherever you're placed for your clinical, and you also get, depending on who your CI is, you also get some hands-on. So for mine, for example, I got a lot of hands-on. I was at a baseball clinic, and I was able to do a lot of hands-on and a lot of techniques that I didn't really know how to do, but my CI was really cool and was able to show me a lot. So that helped me in my later clinical, where I had my first one the following year. So I think that's a really cool pro for all of you that are looking at AT Still that not a lot of schools have, is pretty much putting you in a once-a-week clinical right when you get on campus. So you get to learn a lot and learn a lot fast. For the third point is that your cadavers, they're dissected for you when you come here for your anatomy lab. So for me, I like this because you didn't have to waste too much time trying to dissect all the skin and the fat and everything to get to what you needed to study. You pretty much go into your anatomy labs and everything's dissected for you. So you get to really spend all the time you need to study the blood vessels, the nerves, the muscles, everything that you're there to study. You're putting more time into studying rather than trying to dissect everything first and then study what you need to study. So we actually have a dissection team that does the dissection, which you can do in your end of your first year, I believe, and your second year. And that's a work study position that you can do that I've had a few friends do. So you're able to do that. If you want to do the dissection and you're really into it, I want to do it, you're more than free to apply to that, and that's a separate thing. But in terms of your anatomy class, when you first get to campus, everything's dissected for you, and you get to get right to your studying. For the third point, actually the fourth point, not the third point, pretty much about the professors. So the professors that we have here, they're here for you. They have an open door policy. I haven't had one professor where I didn't feel comfortable either walking into their office or asking them a question or anything like that. Their number one priority is to be a professor and to teach you. Yes, you have faculty that have to do research and do their requirements, but anytime you need help or you're struggling with a topic or anything you might need, the faculty are always here. And I've had every faculty on the first day of class always make that a point and saying that they're going to be here for you and your success, and they don't want you to fail and they don't want you to fall behind. So that's a really great aspect of AT still, is that I can't say that I've had one bad professor. Every professor has cared about our success, has wanted us to be the best practitioners that we can be after we graduate. And I think the professors are a 10 out of 10 at AT still, which for me is a huge plus. And then for the fifth point is about clinical placements. I also think we have a really good clinical program here. The way it works in a short version is you get to have multiple meetings before you get on your third year clinicals, and you get to meet with the clinical instructors that are responsible for placing you for your clinicals. And they really take your choices into account. So if you have any specific either locations or specific physical therapy places that you want to be placed at, it's not 100% that you're going to get it, but if you request it and you have a good reason why you want to go there, they do everything they can to make sure that you get the right fit for your placement. So yeah, I think our clinical program is amazing here, and I know some schools do some lottery systems and some schools you don't have any say in what places you want to go to, but H still does a really good job in taking what the best fit is going to be for you and your future goals, and I really appreciate that from them. And the sixth point that I have is about the location. So AT Still, it's located in a town, for those of you that haven't been to Arizona. It's called Mesa, Arizona. So before coming to Arizona, and a lot of people's preconceived idea of what Arizona is that it's a desert, there's nothing to do out here. And so I was kind of afraid before coming here, thinking that I was going to be stuck in the desert with nothing to do. But Mesa is actually a really cool area. It's a suburban town that is actually by all the big cities. It's 20 minutes away from Phoenix, about 20 minutes away from a town called Scottsdale, 20 minutes from another town called Gilbert, where those are all the towns that have everything to do. So if you're into food, which who isn't into food, there's a bunch of restaurants in all those towns. There's nightlife on the weekends. There's a bunch of hikes to do if you're a big hiker. We have intramurals around campus if you're into sports and want to play some of that. And there's a bunch of stuff to do. So when you come here, there's no limit on what you want to do. If you're into hiking, if you're into nightlife, if you're into eating, if you're into whatever else, Mesa or surrounding town is most likely going to have the thing that you want to do. So there's no shortage of that. So if you have any other questions about that, feel free to reach out to me. And then some other cool pointers that I like about AT Still is that we have a technology in our class called Echo 360. So what that pretty much is it records all your lectures with sound and video. So for example, one of the harder classes like anatomy or something that has a lot of information to it, there might be a day where you miss some information or you're not totally paying attention that one day and you're like, shoot, like what did the professor say on that one point? So you can go back online after and look and see at the part you missed and hear what you missed. And then you can write it down, do whatever you want with that information. So I thought that was a really cool piece of technology that I know also a lot of schools don't have. so you don't have to worry about missing information and wondering what the professor said. You can just go back on your computer afterwards and then look it up. So I think that was a really cool thing. And then the last thing that I want to mention is about our mission statement about serving the underserved community. So this is a super important thing to AT Still University and its mission statement. So AT Still is very big on serving the underserved communities, and a lot of our back to the clinicals, a lot of the clinical partners that they're associated with, they have a lot of clinical placements in underserved areas that they try to send students to, which are amazing experiences from what I've heard. And that should be something you should at least think about, even if you don't want to, after you graduate, work in an underserved community. It's something that you should be open-minded to coming here, since it's the mission statement. And even if you do want clinical placement in an underserved community, just to get the experience of what it's like, it's something that I've heard from every student that has done it is an amazing experience. So if you have any more, or if you want any more information on that, I'd be happy to answer it. So those are pretty much the main points I wanted to talk about AT Still. Overall, I think it's an amazing school. I'm so glad I picked it. I had a few other choices, but in terms of what I was looking for in a school, it was mainly with the points I said: professors, location, the quality of the education, the pass rates for the boards. Everything fell in line with what I wanted and what I was looking for in a school. And AT Still to me was the best choice. And now I'm a second year, almost halfway through my second year. It's crazy. And I still have no regrets. And I'm so glad that I attended AT Still and still attend AT Still. So if you have any more questions about AT Still, I'd love to answer it. I'm also a student ambassador for the program. So I have lots of answers to lots of questions. But yeah, besides that, it was good talking about the school, and I'll talk to you later.
Hey y'all, if you want a little bit more information about a specific DPT program that has not been featured in the Student Speak series, make sure you comment that below, so I'll be sure to look out for all those schools and hunt someone down from that program so I can get them to represent, so that they could give you a little bit more information about that specific program. Alright, let's get on to Jackie.
Hi, my name is Jackie, and I am a third-year student here at Mount St. Mary's University, and I'm going to be sharing with you about the program and what I enjoy about it. So Mount St. Mary's is located in Los Angeles, California. It is a 3-year program with an average class size of 35 students. The way the program is broken up is during your first year, you take classes like gross anatomy, neuroscience, kinesiology, and then when you come to your second year, you take more patient management classes like orthopedic patient management or neuromuscular patient management, because from there you're having 2 clinical rotations, one during your fall semester of second year and one during summer semester of second year. When you come back for your last year, your third and final year, you're taking classes like advanced orthopedics, advanced neuromuscular, geriatrics, pediatrics, medical ethics. There's a lot of other classes that will help prepare you for your final 2 12-week rotations, and then you graduate. I think what's great about the Mount is, in addition to classes that every program offers to help provide you with a good foundation to be a great physical therapist, it also provides classes like therapeutic interactions, and in that class it's very interesting because it helps teach you how to be human. You learn about yourself, you learn about how to handle your stresses, you also learn how to talk to people, how to listen to them, how to interact with them. And I think those are very important skills, especially for our field. Other special classes that this program offers is wound care, women's health, and complementary medicine. Those classes just help provide you with an opportunity to understand what happens in those specialty fields for physical therapy. Another great thing about the Mount is all the different community services we provide, from providing pro bono work at Union Rescue Mission in Skid Row. We also have a neurological pro bono clinic here at the campus, and we also provide pediatrics pro bono care. Once a semester, a couple of students go down to Mexico to provide pediatric pro bono assistance. And another thing that's currently in the works is that the PT program is currently trying to work with the athletic department here at the school so that we PT students could be providing injury or wellness screenings to help these athletes prevent an injury in the future. And I think all these different opportunities just help you open yourself to what PT can do. And I think that's what the great thing about the Mount. In addition to the small class size, which is 35 students, so your classmates are now your family. And then from that, even your professors get to really know you. They know who you are, you get to even talk to them so easily. They all have this open door policy where you can walk into their office as long as the door is open and just talk to them. You can talk about school, you can talk about your life, it doesn't matter. Please just understand that they are here for you. Your professors are all PTs that understand what it was like to be a student, and they're all very excited to see you do great and become a PT. If you have more information about Mount St. Mary's, feel free to contact me. My information should be down in the description box down below, and I want to wish you all good luck in whatever school you choose.
Hey guys, really quick, if you're already getting value from what Tyler and Jackie had to say, go ahead and press that like button. And remember, there's a whole Student Speak series episode playlist, so make sure you go check that out. I'll also put that in the description as well. But let's get back to the series and listen to what Jen has to say.
Hi everyone, my name is Jennifer and I'm a first year student at Baylor University. Before we get started, I just wanted to clarify that there are two Baylor DPT programs. One is the Army Baylor and the other is the Baylor DPT hybrid program. I'm a part of the hybrid program, and this is a newer program. I'm a part of the second cohort. Our first cohort graduates this December 2019, which we're all very excited about, as they will be the first Baylor DPT graduates. My class currently has about 100 students. Baylor University itself is located in Waco, Texas. If you're familiar with Fixer Upper, it's the home of Chip and Joanna Gaines. Although Baylor University is in Texas, my program allows you to be anywhere in the United States or really worldwide, as it is a hybrid program. And I also just wanted to specify, not an online program, it's a hybrid program. So although we do the majority of our coursework online, we are also required to travel to Texas approximately every other month in order to do the lab immersions, which is the hands-on learning. And although I traveled to Dallas, Texas, by the time you all, maybe in the Baylor DPT program, you will be able to experience the brand new facility that will be built for you that is going to be in Waco, Texas. I want to talk a little bit about the strengths of the Baylor DPT program. It is a 2-year accelerated program, which is something that really appealed to me when I was applying for PT schools. It's 1 year shorter than the traditional 3-year program. And I also enjoy that the didactic coursework can be done from home or anywhere that you're located. I am located in Las Vegas, Nevada. I have classmates that are all over the country in Rhode Island, Florida, California, Texas, so we're literally all over the map. Although I love being able to do my coursework at home, it also requires a lot of self-motivation and a lot of dedication and a lot of discipline. It's not a program for everyone, but for the people that are able to be self-motivated and really go-getters, this program is perfect for you. There are specific times that we are required to log on at the same time for all students, and it's just like real class. We get called on during class. You have to turn on your microphone and your webcam, and it answers professors' questions during lectures. If you have any questions, you can ask during the lecture as well. You're able to see the professor's PowerPoint or their presentation, and you're also able to see the professor if they have their camera turned on, which the majority of the time they do. And occasionally they also ask you to turn your camera and microphone on. So it's definitely just as if you were sitting in a real classroom. We do have exams, we have quizzes, lab practicals, assignments, case studies, just like traditional programs. And even though I don't have any classmates that are geographically close to me, I do have a lot of classmates that I'm close to, meaning we text often, we do study guides together, study sessions. We get on FaceTime or Google Group, and we will do a study session just as if we were studying for an exam in person. Our second year of the program is mostly clinicals. We do have some didactic work during that time as well. We have an 8-week inpatient clinical rotation as well as an inpatient another 8-week clinical rotation for our second. And then we also have a 15-week third rotation, which they also term as a terminal internship. And Baylor DPT highly recommends their students to go on to residency, which they assist their students with. And those are the main perks. I literally can talk about Baylor DPT all day, every day. I have a huge passion for this program. I'm very happy that I was fortunate enough to be accepted into the program. And I just love everything about it, from the classmates that I have. The professors are amazing. And just being able to do things from home and to travel every so often in order to get the hands-on learning portion in. If you'd like to learn more about Baylor's DPT program, you can follow them on Facebook or Instagram, Baylor DPT. Or if you have any questions for me, I'm more than happy to answer anything or share more of my experiences with you. My Instagram is at The Future Physical Therapist. So feel free to contact me if you have any questions. Baylor does host webinars. I believe it's once a month, so be sure to follow them on Facebook in order to find out when the next one is, in order for you to be able to find out more information. Thank you so much for listening.
All right, that wraps it up for episode number 4. Tyler, Jackie, and Jen, thank you so much for volunteering all your time and efforts to make this video, to send it to me so that you can represent your program, and for laying out your own time to be available for other pre-physical therapy students to contact you and all of that. So if you're watching and if you have any kind of questions on any of the schools that are represented today, I'll put all their descriptions and handles in the description below. And if you have been liking this video, please feel free to share this to any of your friends. If you have a friend who's also interested in any of these programs that are mentioned, feel free to share it to them, slide in their DMs and say, hey, check out this episode, Student Speaks, baby. So I hope this video helped inspire some self-change to get you into looking into these different programs, or maybe saying, maybe this is not the right program for me. Change people, change people. That's why we live for change, people. Have a great one, you guys.